Question 1. A registered nurse is preparing to delegate tasks to an experienced unlicensed assistive personnel, UAP. Which tasks are appropriate for the RN to delegate to the UAP? Select all that apply. A. Administering oral medications to a stable client. B. Obtaining a client's vital signs and documenting them. C. Assisting a client with ambulation after a hip replacement. D. Performing wound care on a stage 2 pressure injury. E. Reporting observed changes in a client's condition to the nurse. F. Discontinuing an intravenous 4-line. Answer. Obtaining a client's vital signs and documenting them, assisting a client with ambulation after a hip replacement, reporting observed changes in a client's condition to the nurse. This question tests the nurse's understanding of appropriate delegation to an unlicensed assistive personnel, UAP, focusing on routine tasks and observation. Key clues are experienced UAP and tasks that fall within their scope. UAPs can collect vital signs, assist with activities of daily living like ambulation, and report observations to the nurse, as these do not require nursing judgment or invasive procedures. For instance, a UAP can help a post-op client walk down the hall while the nurse manages their pain medication. Remember, UAPs perform routine tasks and report, but never assess, teach, or administer medications. Question 2. The nurse is caring for a client diagnosed with Clostridium difficile, C. difficile, infection. Which personal protective equipment, PPE, should the nurse don before entering the client's room? Select all that apply. A. N95 respirator mask. B. Gown. C. Face shield. D. Gloves. E. Surgical mask. F. Shoe covers. Answer. Gown, gloves. This question assesses knowledge of appropriate infection control measures, specifically for contact precautions related to Clostridium difficile. The crucial clue is Clostridium difficile, which is primarily transmitted through direct and indirect contact and requires specific PPE. A gown and gloves are essential to prevent skin and clothing contamination when caring for a client with C. diff, as the bacteria and spores are easily spread through contact. For example, a nurse would wear these items to assist a client to the bathroom to avoid contact with contaminated surfaces. Always remember that C. diff spores are resistant to alcohol-based hand rub, so thorough hand washing with soap and water is also vital after removing PPE. Question 3. A nurse is preparing to administer medications to a client. Which actions demonstrate adherence to the rights of medication administration? Select all that apply. A. Asking the client to state their name and date of birth. B. Administering medication within 30 minutes of the scheduled time. C. Documenting the medication administration immediately after giving it. D. Crushing all extended-release tablets to facilitate swallowing. E. Checking the medication's expiration date. F. Reviewing the client's allergies before administration. Answer. Asking the client to state their name and date of birth, administering medication within 30 minutes of the scheduled time, documenting the medication administration immediately after giving it, checking the medication's expiration date, reviewing the client's allergies before administration. This question evaluates the nurse's understanding of the rights of medication administration, a foundational concept for client safety. The keyword adherence to the rights signifies the need to apply all relevant safety checks. Identifying the right client, administering at the right time, documenting accurately, verifying the right drug's expiration, and confirming the right client's allergies are all critical components of safe medication practice. For instance, confirming a client's identity with 2 identifiers prevents administering medication to the wrong person, a potentially fatal error. Always remember the 6 rights: right client, medication, dose, route, time, documentation, and integrate them into every medication pass to ensure optimal client safety. Question 4. The nurse is teaching a client about managing their newly prescribed anticoagulant medication at home. Which statements by the client indicate effective learning? Select all that apply. A. I will use an electric razor for shaving. B. I should avoid eating green leafy vegetables. C. I will report any unusual bruising or bleeding to my doctor. D. It's okay to take aspirin for headaches if I need to. E. I will carry a medical alert card with me. F. I need to have regular blood tests to check my medication levels. Answer. I will use an electric razor for shaving. I will report any unusual bruising or bleeding to my doctor. I will carry a medical alert card with me. I need to have regular blood tests to check my medication levels. This question assesses the client's understanding of safety precautions and monitoring for anticoagulant therapy, highlighted by the phrase effective learning about anticoagulant medication. Clients on anticoagulants are at increased risk of bleeding, so using an electric razor prevents cuts. Reporting unusual bleeding alerts the provider to potential complications. Carrying a medical alert card informs emergency personnel, and having regular blood tests monitors the drug's effect. For example, a client using a soft toothbrush instead of a hard one is also demonstrating safe practice. Remember to emphasize bleeding precautions and the importance of compliance with monitoring appointments for optimal therapeutic effect and safety. Question 5. A nurse is assessing a client experiencing symptoms of fluid volume deficit, dehydration. Which findings would the nurse expect to observe? Select all that apply. A. Bounding peripheral pulses. B. Decreased skin turgor. C. Bradycardia. D. Dry mucous membranes. E. Oliguria. F. Increased blood pressure. Answer. Decreased skin turgor, dry mucous membranes, oliguria. This question tests the nurse's ability to recognize the clinical manifestations of fluid volume deficit, with fluid volume deficit, dehydration being the key concept. Dehydration leads to reduced fluid in the vascular space and tissues, causing specific signs. Decreased skin turgor, skin that stays tented when pinched, dry mucous membranes, inside the mouth, and oliguria, decreased urine output, are all direct indicators of insufficient fluid volume in the body. For instance, a client might also report feeling very thirsty and dizzy when standing up. Remember, in dehydration, the body tries to conserve fluid, leading to concentrated urine and signs of dryness. Question 6. The nurse is preparing to administer a blood transfusion. Which actions are essential for the nurse to perform to ensure client safety? Select all that apply. A. Verify the client's identity with another licensed nurse. B. Administer pre-medications for potential allergic reactions to all clients. C. Check the blood product against the physician's order and client identifiers. D. Obtain baseline vital signs before starting the transfusion. E. Use a 22-gauge peripheral intravenous catheter for infusion. F. Stay with the client for the first 15 to 30 minutes of the transfusion. Answer. Verify the client's identity with another licensed nurse. Check the blood product against the physician's order and client identifiers. Obtain baseline vital signs before starting the transfusion. Stay with the client for the first 15 to 30 minutes of the transfusion. This question focuses on critical safety measures during blood product administration, with blood transfusion and client safety as key phrases. 2 licensed nurses must verify client identity and blood product details to prevent errors, and baseline vital signs are crucial for comparison if a reaction occurs. The nurse must remain with the client during the initial phase to monitor for immediate transfusion reactions, which are most likely to occur then. For example, a sudden drop in blood pressure or a rash during this initial period would require immediate intervention. Remember, meticulous attention to detail and close observation are paramount to prevent severe transfusion complications. Question 7. A nurse is providing discharge teaching to a client diagnosed with heart failure. Which instructions should the nurse include in the teaching plan? Select all that apply. A. Weigh yourself daily and report a gain of 2 to 3 pounds in a day. B. Limit your fluid intake to no more than 1.5-2 liters per day. C. Engage in vigorous exercise daily to strengthen your heart. D. Monitor for swelling in your ankles, feet, and abdomen. E. Increase your sodium intake to help retain fluids. F. Report any shortness of breath or increased fatigue. Answer. Weigh yourself daily and report a gain of 2 to 3 pounds in a day. Limit your fluid intake to no more than 1.5-2 liters per day. Monitor for swelling in your ankles, feet, and abdomen. Report any shortness of breath or increased fatigue. This question assesses the nurse's knowledge of essential self-management strategies for clients with heart failure, indicated by discharge teaching and heart failure. Daily weight monitoring helps detect fluid retention early. Fluid restrictions prevent fluid overload. Monitoring for edema, swelling, identifies worsening fluid status, and reporting symptoms like shortness of breath signals exacerbations requiring medical attention. For example, a client who notices their shoes fit tighter might be experiencing fluid retention and should report this. Encourage clients to be vigilant about these signs and symptoms, as early recognition can prevent rehospitalization. Question 8. The nurse is assessing a client suspected of having a urinary tract infection, UTI. Which symptoms would support this diagnosis? Select all that apply. A. Polyuria. B. Dysuria. C. Hematuria. D. Urinary urgency. E. Flank pain. F. Foul-smelling urine. Answer. Dysuria, hematuria, urinary urgency, flank pain, foul-smelling urine. This question evaluates the nurse's ability to recognize the common signs and symptoms of a urinary tract infection, with urinary tract infection, UTI, as the central clue. Dysuria, painful urination, hematuria, blood in the urine, urinary urgency, sudden, compelling need to urinate, flank pain, pain in the side and back, typically below the ribs and above the pelvis, and foul-smelling urine are all characteristic indicators of a UTI. For instance, a client might complain of a burning sensation when they void. These symptoms result from bacterial inflammation of the urinary tract and warrant further diagnostic testing and treatment. Question 9. A client in the emergency department reports crushing chest pain radiating to their left arm. The nurse recognizes these as potential signs of a myocardial infarction, MI. Which initial actions should the nurse prioritize? Select all that apply. A. Administer intravenous, fluids rapidly. B. Obtain an electrocardiogram, ECG. C. Administer oxygen via nasal cannula. D. Initiate a peripheral 4-line. E. Administer nitroglycerin sublingually, if ordered. If. Prepare for immediate cardioversion. Answer. Obtain an electrocardiogram, ECG, administer oxygen via nasal cannula, initiate a peripheral 4-line, administer nitroglycerin sublingually, if ordered. This question tests the nurse's immediate priorities in a suspected myocardial infarction, MI, scenario, with crushing chest pain radiating to their left arm and potential signs of a myocardial infarction, MI. As crucial clues, prompt actions focus on assessing cardiac function, providing oxygen, establishing access for medications, and administering pain-relieving vasodilators like nitroglycerin. Obtaining an ECG helps diagnose the MI type. Oxygen improves myocardial oxygenation, for access is critical for rapid medication delivery, and nitroglycerin helps reduce chest pain and improve blood flow. For example, the nurse would ensure the client is in a semi-Fowler's position to ease breathing while applying oxygen. Prioritizing these interventions helps preserve cardiac muscle and stabilize the client's condition. Question 10. The nurse is caring for a client with a new colostomy. Which stoma characteristics would indicate a healthy, well-perfused stoma? Select all that apply. A. Dark blue or purple color. B. Moist appearance. C. Beefy red color. D. Pale and dry appearance. E. Presence of slight bleeding when touched. F. Protruding slightly from the abdomen. Answer. Moist appearance, beefy red color, presence of slight bleeding when touched, protruding slightly from the abdomen. This question assesses the nurse's ability to identify a healthy colostomostoma, with new colostomy and healthy, well-perfused stoma as keywords. A healthy stoma should appear beefy red, indicating good blood supply, and moist, reflecting its mucous membrane nature. Slight bleeding when touched is normal due to its vascularity, and it should protrude slightly to allow for proper stool collection. For instance, a stoma resembling the inside of a client's mouth in color and moisture is considered healthy. Any signs of pallor, dryness, or dusky discoloration require immediate nursing intervention as they may indicate ischemia. Question 11. The nurse is educating a client about effective strategies for pain management. Which approaches should the nurse include in the teaching plan? Select all that apply. A. Taking pain medication only when pain becomes severe. B. Using relaxation techniques such as deep breathing. C. Requesting pain medication before activities that exacerbate pain. D. Applying heat or cold packs to the painful area. E. Avoiding any physical activity to prevent pain. F. Keeping a pain diary to identify patterns and triggers. Answer. Using relaxation techniques such as deep breathing, requesting pain medication before activities that exacerbate pain, applying heat or cold packs to the painful area, keeping a pain diary to identify patterns and triggers. This question focuses on comprehensive and proactive pain management strategies, highlighted by effective strategies for pain management. Holistic pain control involves both pharmacological and non-pharmacological methods. Relaxation techniques, pre-medicating before painful activities, using topical heat/cold, and tracking pain patterns in a diary are all effective ways to manage pain proactively and improve comfort. For example, a client with chronic back pain might apply a warm pack before doing exercises to help loosen muscles. Encourage clients to take an active role in their pain management by utilizing multiple methods and communicating their needs. Question 12. A nurse is providing care for a client in skeletal traction. Which nursing interventions are appropriate for this client? Select all that apply. A. Remove the weights if the client reports discomfort. B. Perform frequent neurovascular assessments on the affected extremity. C. Ensure the weights are hanging freely and not resting on the floor. D. Provide pin site care as ordered, observing for signs of infection. E. Encourage the client to remain completely immobile to prevent dislodgement. F. Reposition the client every 2 hours, ensuring proper body alignment. Answer. Perform frequent neurovascular assessments on the affected extremity, ensure the weights are hanging freely and not resting on the floor, provide pin site care as ordered, observing for signs of infection, reposition the client every 2 hours, ensuring proper body alignment. This question assesses the nurse's understanding of care for a client in skeletal traction, with skeletal traction as the main concept. Proper management of traction requires diligent attention to the traction setup, client comfort, skin integrity, and neurovascular status. Frequent neurovascular assessments monitor circulation and nerve function. Weights must hang freely for continuous pull, meticulous pin site care prevents infection, and regular repositioning with proper alignment prevents complications like pressure injuries. For example, the nurse should check the client's toes for color, temperature, movement, and sensation. Maintaining the integrity of the traction system and client's skin is paramount for optimal healing and preventing complications. Question 13. The nurse is reinforcing teaching with a client about preventing falls in the home environment. Which instructions should the nurse include? Select all that apply. A. Remove throw rugs from pathways. B. Install grab bars in the bathroom. C. Keep the house dimly lit at night. D. Wear well-fitting, non-slip shoes. E. Use a step stool to reach high shelves. F. Ensure pathways are clutter-free. Answer. Remove throw rugs from pathways, install grab bars in the bathroom, wear well-fitting, non-slip shoes, ensure pathways are clutter-free. This question evaluates the nurse's knowledge of essential home safety measures for fall prevention, with preventing falls in the home environment as the key instruction. Eliminating tripping hazards like throw rugs, providing support in high-risk areas like bathrooms with grab bars, promoting stable footwear, and maintaining clear pathways are all critical interventions to reduce fall risk. For example, advising a client to keep their eyeglasses clean and within reach also helps prevent falls caused by impaired vision. Emphasize that a safe environment combined with appropriate footwear significantly reduces the likelihood of falls. Question 14. A nurse is providing care for a client receiving enteral tube feedings. Which actions are appropriate to prevent complications? Select all that apply. A. Elevate the head of the bed to at least 30 to 45 degrees during feeding. B. Check gastric residual volume every 4 to 6 hours for continuous feedings. C. Administer feedings cold to reduce bacterial growth. D. Flush the feeding tube with water before and after medication administration. E. Change the feeding bag and tubing every 24 hours. F. Monitor the client for signs of aspiration, such as coughing or dyspnea. Answer. Elevate the head of the bed to at least 30 to 45 degrees during feeding. Check gastric residual volume every 4 to 6 hours for continuous feedings. Flush the feeding tube with water before and after medication administration. Change the feeding bag and tubing every 24 hours. Monitor the client for signs of aspiration, such as coughing or dyspnea. This question assesses the nurse's knowledge of safe practices for enteral tube feedings and complication prevention, focusing on enteral tube feedings and prevent complications. Elevating the head of the bed reduces aspiration risk. Checking residual volumes monitors gastric emptying. flushing the tube prevents clogging, changing equipment regularly reduces infection, and vigilant monitoring for aspiration signs ensures client safety. For instance, if a client suddenly starts coughing during a feeding, the nurse would immediately stop the feeding and assess for aspiration. These measures are crucial for maintaining client comfort and preventing serious adverse events associated with tube feedings. Question 15. The nurse is caring for a client experiencing an acute asthma exacerbation. Which assessment findings would indicate worsening respiratory distress? Select all that apply. A. Bradypnea. B. Inspiratory and expiratory wheezing. C. Use of accessory muscles for breathing. D. Pink and warm skin. E. Paradoxical breathing. E. Decreased level of consciousness. Answer. Bradypnea, inspiratory and expiratory wheezing, use of accessory muscles for breathing, paradoxical breathing, decreased level of consciousness. This question tests the nurse's ability to recognize serious signs of respiratory compromise in a client with asthma, focusing on acute asthma exacerbation and worsening respiratory distress. Bradypnea, abnormally slow breathing, can indicate fatigue and impending respiratory failure. Inspiratory and expiratory wheezing reflect airway constriction. Use of accessory muscles shows increased work of breathing. Paradoxical breathing, chest wall moving inward on inspiration, outward on expiration, signifies severe distress, and a decreased level of consciousness indicates hypoxia. For example, if a client who was previously wheezing loudly suddenly has diminished or absent breath sounds, this is an ominous sign of severe airway obstruction. These findings demand immediate and aggressive intervention to prevent respiratory arrest. Question 16. A nurse is preparing a client for discharge after a stroke. Which topics are essential to include in the discharge teaching plan? Select all that apply. A. Medication regimen and potential side effects. B. Signs and symptoms of a recurrent stroke. C. Importance of a low-sodium diet. D. Resources for rehabilitation and support groups. E. Techniques for safe transfer and mobility. E. How to self-administer intravenous fluids at home. Answer. Medication regimen and potential side effects, signs and symptoms of a recurrent stroke, importance of a low-sodium diet, resources for rehabilitation and support groups, techniques for safe transfer and mobility. This question focuses on comprehensive discharge planning for a stroke client, with discharge after a stroke and essential to include as key phrases. Teaching about medications ensures adherence and safety. Recognizing recurrent stroke symptoms allows for prompt medical attention. Dietary modifications like a low-sodium diet help prevent future cardiovascular events. Providing rehabilitation resources promotes recovery, and teaching safe transfer techniques enhances independence and prevents injury. For instance, demonstrating how to use a gait belt for transfers empowers the client and caregiver. Effective discharge teaching is vital for preventing complications and promoting the best possible recovery outcomes. Question 17. The nurse is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. Which actions are appropriate for the nurse to perform? Select all that apply. A. Verify tube placement by injecting air and auscultating for a whoosh. B. Elevate the head of the bed to at least 30 degrees. C. Assess nasal skin for irritation or breakdown. D. Irrigate the tube with 0.9% sodium chloride as prescribed. E. Administer oral medications through the NG tube without checking placement. E. Turn off suction during client ambulation or repositioning. Answer. Elevate the head of the bed to at least 30 degrees. Assess nasal skin for irritation or breakdown. Irrigate the tube with 0.9% sodium chloride as prescribed. Turn off suction during client ambulation or repositioning. This question evaluates the nurse's understanding of proper care for a client with a nasogastric tube for decompression, indicated by nasogastric (NG) tube and gastric decompression. Elevating the head of the bed prevents aspiration. Regularly assessing nasal skin prevents pressure injuries. Irrigating the tube maintains patency, and temporarily clamping or turning off suction during mobility prevents fluid and electrolyte imbalance and discomfort. For example, before irrigating, the nurse would ensure proper placement of the tube by aspirating gastric contents and checking pH. Proper NG tube management is essential to prevent complications and ensure therapeutic effectiveness. Question 18. A nurse is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. Which comfort measures can the nurse implement for this client? Select all that apply. A. Offer frequent sips of water. B. Provide oral hygiene, including brushing teeth. C. Apply a cool cloth to the client's forehead. D. Provide ice chips every hour. E. Lubricate lips with petroleum jelly. F. Offer hard candy to relieve dry mouth. Answer. Provide oral hygiene, including brushing teeth. Apply a cool cloth to the client's forehead. Lubricate lips with petroleum jelly. This question addresses comfort measures for a client who is NPO, a common scenario in preoperative care, with NPO and comfort measures as key concepts. While the client cannot ingest anything, nurses can provide relief by addressing dryness and general discomfort. Oral hygiene helps prevent dry mouth and freshens breath. A cool cloth can provide general comfort, and petroleum jelly prevents chapped lips. For instance, the nurse might offer a client mouthwash for rinsing, reminding them not to swallow. These interventions are crucial for maintaining client comfort and dignity without compromising their NPO status. Question 19. The nurse is educating a new mother about safe sleep practices for her newborn. Which statements should the nurse include in the teaching? Select all that apply. A. Place your baby on their back to sleep. B. It's safe to co-sleep with your baby in your bed. C. Use a firm mattress in the crib. D. Place soft blankets and toys in the crib for comfort. E. Ensure the crib sheets fit snugly. F. Keep the room temperature cool, between 68 to 72 degrees Fahrenheit, 20-22 degrees C. Answer. Place your baby on their back to sleep. Use a firm mattress in the crib. Ensure the crib sheets fit snugly. Keep the room temperature cool, between 68 to 72 degrees Fahrenheit, 20-22 degrees C. This question assesses the nurse's knowledge of safe sleep practices for infants to prevent sudden infant death syndrome, SIDS, with safe sleep practices and newborn as the critical focus. Placing infants on their back, using a firm mattress, ensuring snugly fitted sheets, and maintaining an appropriate room temperature are all evidence-based recommendations to reduce SIDS risk. For example, telling the mother to avoid bumper pads and loose bedding is also part of creating a safe sleep environment. Emphasize these practices to new parents to ensure the safest possible sleep for their baby. Question 20. A nurse is assessing a client's peripheral 4 insertion site. Which findings would indicate infiltration? Select all that apply. A. Warmth around the site. B. Pallor at the site. C. Edema at the site. D. Pain at the site. E. Redness along the vein. F. Absence of blood return upon aspiration. Answer: pallor at the site, edema at the site, pain at the site, absence of blood return upon aspiration. This question tests the nurse's ability to identify signs of fore infiltration, a common complication, with peripheral fore insertion site and infiltration as the key terms. Infiltration occurs when fore fluid leaks into the surrounding subcutaneous tissue. Pallor, paleness, localized edema, swelling, pain or tenderness, and absence of blood return when the fore is aspirated are classic signs of fluid extravasation. For example, the nurse might notice the client's hand is visibly swollen and cool to the touch above the fore site. Prompt recognition and discontinuation of the fore are crucial to prevent tissue damage. Question 21. The nurse is preparing to administer an opioid analgesic to a client. Which assessments are essential for the nurse to perform before administration? Select all that apply. A. Assess the client's pain level. B. Check the client's current blood pressure. C. Review the client's last bowel movement. D. Assess the client's respiratory rate and depth. E. Verify the client's allergy status. F. Check the client's pupil size. Answer: assess the client's pain level, check the client's current blood pressure, review the client's last bowel movement, assess the client's respiratory rate and depth, verify the client's allergy status. This question focuses on essential pre-administration assessments for opioid analgesics, with opioid analgesic and essential for the nurse to perform as key phrases. Before giving opioids, the nurse must assess the client's pain to ensure the medication is needed and effective, check blood pressure for hypotension risk, review bowel function due to opioid-induced constipation, assess respiratory rate and depth because of respiratory depression risk, and confirm allergy status for safety. For example, if a client's respiratory rate is 8 breaths per minute, the nurse should hold the opioid and notify the provider. These assessments are critical for client safety and appropriate pain management. Question 22. A nurse is providing education to a client diagnosed with type 2 diabetes regarding foot care. Which instructions should the nurse include? Select all that apply. A. Inspect your feet daily for cuts, blisters, or redness. B. Wear tight-fitting shoes to support your arches. C. Trim your toenails straight across. D. Apply lotion between your toes to prevent dryness. E. Wear clean, dry socks made of cotton or wool. F. Avoid walking barefoot, even at home. Answer: inspect your feet daily for cuts, blisters, or redness, trim your toenails straight across, wear clean, dry socks made of cotton or wool, avoid walking barefoot, even at home. This question assesses the nurse's understanding of crucial foot care guidelines for clients with diabetes, where type 2 diabetes and foot care are primary concerns due to increased risk of neuropathy and poor circulation. Daily inspection helps detect issues early. Trimming toenails straight across prevents ingrown nails, wearing appropriate socks reduces friction and keeps feet dry, and avoiding bare feet prevents injury. For instance, a client should use a mirror to check the soles of their feet if they cannot easily bend over. Emphasize that meticulous foot care is vital to prevent infections and serious complications like amputations. Question 23. The nurse is caring for a client who is experiencing symptoms of hypoglycemia. Which findings would the nurse expect to observe? Select all that apply. A. Warm, moist skin. B. Shakiness or tremors. C. Polydipsia, excessive thirst. D. Blurred vision. E. Tachycardia. F. Confusion or irritability. Answer: shakiness or tremors, blurred vision, tachycardia, confusion or irritability? This question tests the nurse's ability to identify the clinical manifestations of hypoglycemia, low blood sugar, which is indicated by symptoms of hypoglycemia. When blood sugar levels drop, the body releases counterregulatory hormones, leading to specific physical and neurological signs. Shakiness, blurred vision, tachycardia, fast heart rate, and confusion or irritability are all characteristic symptoms resulting from the brain's lack of glucose and the body's compensatory stress response. For example, a client might also report feeling very hungry or dizzy. Prompt recognition and treatment are crucial to prevent severe neurological complications. Question 24. A nurse is caring for a client receiving chemotherapy who reports nausea and vomiting. Which interventions can the nurse implement to help manage these symptoms? Select all that apply. A. Administer antiemetic medications as prescribed before chemotherapy. B. Encourage the client to eat large, heavy meals. C. Offer small, frequent meals of bland foods. D. Provide oral hygiene before and after meals. E. Avoid strong odors in the client's room. F. Encourage the client to drink carbonated beverages. Answer. Administer antiemetic medications as prescribed before chemotherapy, offer small, frequent meals of bland foods, provide oral hygiene before and after meals, avoid strong odors in the client's room. This question focuses on managing chemotherapy-induced nausea and vomiting, a common and distressing side effect. Chemotherapy and nausea and vomiting are the key problem areas. Prophylactic antiemetics prevent symptoms, small and frequent bland meals are easier to tolerate, oral hygiene removes unpleasant tastes, and avoiding strong odors reduces triggers. For example, offering dry toast or crackers can sometimes help settle the stomach. These interventions aim to alleviate discomfort and support nutritional intake in clients undergoing cancer treatment. Question 25. The nurse is preparing to insert an indwelling urinary catheter into a female client. Which actions demonstrate appropriate sterile technique and client safety? Select all that apply. A. Position the client in a supine position with knees flexed and hips rotated externally. B. Cleanse the perineal area from anus to meatus. C. Use sterile gloves and a sterile field. D. Inflate the catheter balloon before insertion to check for leaks. E. Lubricate the catheter tip generously. F. Insert the catheter until urine flow is observed, then advance 1 to 2 inches further. Answer. Position the client in a supine position with knees flexed and hips rotated externally, use sterile gloves and a sterile field, lubricate the catheter tip generously, insert the catheter until urine flow is observed, then advance 1 to 2 inches further. This question evaluates the nurse's understanding of correct sterile technique and client safety during indwelling catheter insertion, with indwelling urinary catheter and sterile technique and client safety as crucial elements. Proper positioning facilitates visualization, sterile gloves and field prevent infection, generous lubrication minimizes trauma, and advancing the catheter beyond initial urine flow ensures the balloon inflates in the bladder. For example, cleansing the perineal area from front to back, meatus to anus, is also essential for infection control. Adhering to these steps minimizes the risk of urinary tract infection and client discomfort. Question 26. A nurse is caring for a client receiving continuous oxygen therapy via nasal cannula. Which actions are appropriate for the nurse to take? Select all that apply. A. Assess skin integrity behind the ears and around the nares. B. Encourage the client to take shallow breaths for comfort. C. Ensure the oxygen flow rate is set as prescribed. D. Use water-based lubricant on the client's lips and nares. E. Instruct the client to smoke only in designated outdoor areas. F. Monitor the client's oxygen saturation with a pulse oximeter. Answer. Assess skin integrity behind the ears and around the nares. Ensure the oxygen flow rate is set as prescribed. Use water-based lubricant on the client's lips and nares. Monitor the client's oxygen saturation with a pulse oximeter. This question focuses on safe and effective care for a client receiving oxygen via nasal cannula, with continuous oxygen therapy via nasal cannula as the key. Assessing skin prevents breakdown from tubing pressure and dryness, ensuring the correct flow rate maintains therapeutic levels. Using water-based lubricant prevents irritation, and monitoring oxygen saturation confirms effectiveness. For example, if the client reports soreness behind their ears, the nurse would check for pressure points and adjust the cannula. These interventions prioritize client comfort, safety, and the efficacy of oxygen delivery. Question 27. The nurse is caring for a client with a history of seizures. Which interventions should the nurse include in the client's plan of care to ensure safety during a seizure? Select all that apply. A. Keep the client's bed in the lowest position. B. Place a tongue blade in the client's mouth to prevent biting. C. Pad the side rails of the bed. D. Loosen restrictive clothing around the client's neck. E. Ensure suction equipment and oxygen are readily available. F. Restrain the client's extremities during the seizure to prevent injury. Answer. Keep the client's bed in the lowest position, pad the side rails of the bed, loosen restrictive clothing around the client's neck, ensure suction equipment and oxygen are readily available. This question addresses crucial safety measures for a client with a seizure disorder, indicated by history of seizures, and ensure safety during a seizure. Keeping the bed low, padding side rails, and loosening clothing protect the client from injury, while having suction and oxygen ready addresses potential airway compromise and hypoxia. For instance, the nurse would also remove any objects from the immediate area to prevent the client from striking them during uncontrolled movements. Remember to protect the client during a seizure but never restrain their movements or force anything into their mouth, as this can cause more harm. Question 28. A nurse is providing care for a client who is experiencing delirium. Which nursing interventions are appropriate for this client? Select all that apply. A. Reorient the client frequently to time, place, and person. B. Maintain a consistent daily routine. C. Restrain the client to prevent agitation. D. Provide a quiet, well-lit environment. E. Encourage family members to visit and interact. F. Avoid discussing current events or recent changes. Answer. Reorient the client frequently to time, place, and person, maintain a consistent daily routine, provide a quiet, well-lit environment, encourage family members to visit and interact. This question focuses on appropriate nursing interventions for a client with delirium, which is characterized by acute confusion and fluctuating mental status. Reorientation, maintaining a consistent routine, providing a calm environment, and encouraging family presence all help reduce confusion and anxiety. For example, placing a clock and calendar within the client's view can aid in reorientation. These strategies aim to stabilize the client's cognitive state and promote a sense of security and familiarity. Question 29. The nurse is assessing a client's wound for signs of infection. Which findings would indicate a wound infection? Select all that apply. A. Erythema, redness, around the wound. B. Edema, swelling, at the wound site. C. Warmth at the wound site. D. Purulent drainage. E. Foul odor. F. Presence of granulation tissue. Answer. Erythema, redness, around the wound, edema, swelling, at the wound site, warmth at the wound site, purulent drainage, foul odor. This question tests the nurse's ability to identify the classic signs of a wound infection, with wound infection as the key concept. The cardinal signs of inflammation and infection are erythema, redness, edema, swelling, and warmth due to increased blood flow to the area. Purulent drainage, pus, and a foul odor directly indicate bacterial presence. For example, a client might also report increased pain at the wound site or have a fever. Early recognition and treatment of these signs are crucial to prevent further complications and promote wound healing. Question 30. A nurse is preparing to administer medications through a percutaneous endoscopic gastrostomy (PEG) tube. Which actions should the nurse take? Select all that apply. A. Crush all medications together and administer them in one flush. B. Check for proper tube placement before administering medications. C. Flush the tube with 15 to 30 milliliters of water before and after each medication. D. Administer liquid medications whenever possible. E. Mix medications with tube feeding formula for easier administration. F. Elevate the head of the bed to at least 30 degrees during administration. Answer. Check for proper tube placement before administering medications. Flush the tube with 15 to 30 milliliters of water before and after each medication. Administer liquid medications whenever possible. Elevate the head of the bed to at least 30 degrees during administration. This question focuses on safe medication administration via a PEG tube, emphasized by administer medications through a percutaneous endoscopic gastrostomy (PEG) tube. Verifying placement prevents medication from entering the lungs. Flushing maintains tube patency. Using liquid forms minimizes clogging, and elevating the head of the bed reduces aspiration risk. For example, crushing pills individually and dissolving them in water helps prevent tube occlusion. Always prioritize patient safety and tube patency when administering medications through enteral tubes. Question 31. The nurse is assessing a client who has a chest tube. Which findings require immediate intervention by the nurse? Select all that apply. A. Continuous bubbling in the water seal chamber. B. Fluctuation, tidling, in the water seal chamber with respirations. C. Drainage of 50 milliliters in the collection chamber over 8 hours. D. Sudden cessation of drainage from the chest tube. E. Disconnection of the chest tube from the drainage system. F. Subcutaneous emphysema around the insertion site. Answer. Continuous bubbling in the water seal chamber, sudden cessation of drainage from the chest tube, disconnection of the chest tube from the drainage system, subcutaneous emphysema around the insertion site. This question tests the nurse's ability to identify urgent complications related to a chest tube, with chest tube and immediate intervention as key phrases. Continuous bubbling in the water seal chamber suggests an air leak. Sudden cessation of drainage may indicate a clot or kink. Disconnection requires immediate re-establishment of the system to prevent pneumothorax, and subcutaneous emphysema signifies air leakage into tissues. For instance, if the chest tube disconnects, the nurse would immediately clamp the tube closest to the client, if protocol allows, and submerge the end in sterile water or cover the insertion site with an occlusive dressing. Recognizing these critical signs is vital to prevent severe respiratory compromise. Question 32. A nurse is providing care for a client who is immobile. Which interventions are appropriate to prevent complications associated with immobility? Select all that apply. A. Reposition the client every 4 hours. B. Encourage deep breathing and coughing exercises. C. Provide range of motion exercises to all extremities. D. Administer prophylactic anticoagulants as prescribed. E. Keep the client's heels elevated off the bed surface. F. Limit fluid intake to prevent bladder distension. Answer. Encourage deep breathing and coughing exercises, provide range of motion exercises to all extremities, administer prophylactic anticoagulants as prescribed, keep the client's heels elevated off the bed surface. This question focuses on preventative measures for complications arising from immobility, indicated by immobile and prevent complications. Deep breathing and coughing prevent respiratory complications like pneumonia, range of motion exercises prevent contractures and improve circulation, prophylactic anticoagulants prevent deep vein thrombosis, DVT, and heel elevation prevents pressure injuries. For example, using a footboard or pillows to keep heels off the bed reduces pressure on vulnerable areas. These proactive measures are critical to maintaining the client's physical health and preventing secondary conditions associated with prolonged bed rest. Question 33. The nurse is providing education to a client prescribed a new diuretic medication. Which statements indicate the client understands the teaching? Select all that apply. A. I will take my medication at bedtime to ensure maximum effect. B. I need to increase my fluid intake significantly. C. I will weigh myself daily and report significant changes. D. I should avoid foods high in potassium. E. I will report any muscle weakness or irregular heartbeats. F. I need to get up slowly from a sitting or lying position. Answer. I will weigh myself daily and report significant changes. I should avoid foods high in potassium. I will report any muscle weakness or irregular heartbeats. I need to get up slowly from a sitting or lying position. This question assesses a client's understanding of managing diuretic therapy with new diuretic medication and understands the teaching as key indicators. Daily weight monitoring helps detect excessive fluid loss, avoiding high potassium foods, especially with potassium-sparing diuretics, prevents hyperkalemia, reporting muscle weakness or irregular heartbeats alerts to electrolyte imbalances, and rising slowly prevents orthostatic hypotension. For instance, a client taking a loop diuretic might also need to increase potassium intake. Clients must understand these precautions to prevent serious electrolyte imbalances and falls. Question 34. A nurse is caring for a client with a history of intravenous drug use. Which health screenings are important for this client population? Select all that apply. A. Hepatitis B and C screening. B. HIV screening. C. Tuberculosis, TB, screening. D. Sexually transmitted infection, STI, screening. E. Liver function tests. F. Genetic counseling for hereditary conditions. Answer. Hepatitis B and C screening, HIV screening, tuberculosis, TB, screening, sexually transmitted infection, STI, screening, liver function tests. This question addresses comprehensive health screenings for clients with a history of intravenous drug use, where intravenous drug use is a significant risk factor for various infections and organ damage. Sharing needles increases the risk of blood-borne pathogens like hepatitis B, C, and HIV. Compromised immunity and living conditions can increase TB risk, and STIs are often comorbid. Liver function tests monitor for drug-induced or infection-related liver damage. For example, regular screening for these conditions allows for early detection and intervention, improving client outcomes. Comprehensive screening is crucial for identifying and managing the health consequences associated with this risk behavior. Question 35. The nurse is educating a client about the benefits of smoking cessation. Which health improvements should the nurse emphasize? Select all that apply. A. Increased risk of heart disease. B. Improved lung function over time. C. Decreased risk of cancer development. D. Enhanced sense of taste and smell. E. Reduced circulation to extremities. E. Improved skin appearance. Answer. Improved lung function over time, decreased risk of cancer development, enhanced sense of taste and smell, improved skin appearance. This question focuses on the positive health outcomes of smoking cessation, highlighted by benefits of smoking cessation. Quitting smoking leads to significant improvements across multiple body systems. Lung function gradually improves, the risk of developing various cancers decreases, sensory perceptions like taste and smell enhance, and skin appearance improves due to better circulation. For example, a client might notice they can breathe easier and food tastes better within weeks of quitting. Emphasize that positive changes begin almost immediately and continue for years, offering powerful motivation. Question 36. A nurse is assessing a client for signs of impending death. Which findings would the nurse expect to observe? Select all that apply. A. Increased appetite and thirst. B. Cheyne-Stokes respirations. C. Mottling of the extremities. D. Increased alertness and energy. E. Inability to swallow. E. Decreased urine output. Answer. Cheyne-Stokes respirations, mottling of the extremities, inability to swallow, decreased urine output. This question addresses the physical signs indicating impending death, with signs of impending death as the core concept. As the body systems shut down, distinct changes occur. Cheyne-Stokes respirations, cycles of deep breathing followed by shallow breaths or apnea, reflect brain stem changes. Mottling, patchy discoloration, of extremities indicates poor circulation, inability to swallow poses aspiration risk, and decreased urine output signifies failing renal function. For example, the client's skin might also feel cool to the touch. Recognizing these signs helps nurses provide appropriate comfort care and prepare families for the client's passing. Question 37. The nurse is preparing to insert a peripheral intravenous catheter. Which actions demonstrate appropriate technique and safety? Select all that apply. A. Select a vein distal to previous venipuncture sites. B. Apply a tourniquet loosely above the chosen site. C. Cleanse the insertion site with an antiseptic solution in a circular motion, moving inward. D. Anchor the vein below the insertion site before puncture. E. Insert the needle at a 45-degree angle directly into the vein. E. Advance the catheter into the vein after flashback is observed. Answer. Select a vein distal to previous venipuncture sites, anchor the vein below the insertion site before puncture, advance the catheter into the vein after flashback is observed. This question evaluates proper technique and safety for peripheral 4 insertion, with peripheral intravenous catheter and appropriate technique and safety as key phrases. Selecting a distal vein preserves proximal sites for future use, anchoring the vein prevents it from rolling, and advancing the catheter after flashback ensures the tip is properly within the vein lumen. For example, The nurse would also cleanse the site from the center outward to ensure sterility. Proper venipuncture technique is crucial to minimize discomfort, prevent complications, and ensure successful fore access. Question 38. A nurse is caring for a client who is receiving total parenteral nutrition, TPN. Which actions are appropriate for the nurse to include in the plan of care? Select all that apply. A. Monitor blood glucose levels regularly. B. Administer TPN through a peripheral 4-line. C. Change the TPN tubing every 72 hours. D. Monitor for signs of infection at the central line insertion site. E. Weigh the client daily. If. Initiate TPN abruptly to reach target rate quickly. Answer. Monitor blood glucose levels regularly, monitor for signs of infection at the central line insertion site, weigh the client daily. This question focuses on the safe management of total parenteral nutrition, TPN, indicated by total parenteral nutrition, TPN. TPN contains high glucose concentrations, necessitating regular blood glucose monitoring. TPN is typically administered via a central line, making infection monitoring at the insertion site crucial. Daily weights assess fluid balance and nutritional effectiveness. For example, the nurse would also assess for fever or chills as signs of a central line-associated bloodstream infection. Careful monitoring is essential to prevent metabolic and infectious complications associated with TPN. Question 39. The nurse is preparing to administer medications to a client with dysphagia, difficulty swallowing. Which interventions are appropriate to ensure safe administration? Select all that apply. A. Position the client in a supine position. B. Crush all tablets and mix with a large amount of food. C. Provide thickened liquids as appropriate. D. Administer medications one at a time. E. Assess the client's gag reflex before administering. F. Encourage the client to drink through a straw. Answer. Provide thickened liquids as appropriate, administer medications one at a time, assess the client's gag reflex before administering. This question addresses safe medication administration for clients with dysphagia, difficulty swallowing, with dysphagia and safe administration as the crucial focus. Providing thickened liquids helps prevent aspiration, administering medications one at a time allows for proper swallowing between doses, and assessing the gag reflex confirms the client's ability to protect their airway. For instance, the nurse might also offer the client a small sip of water before and after each medication. These interventions are vital to prevent aspiration pneumonia, a serious complication for clients with swallowing difficulties. Question 40. A nurse is caring for a client who is exhibiting signs of anxiety. Which therapeutic communication techniques should the nurse use? Select all that apply. A. Asking why are you feeling anxious? B. Using open-ended questions. C. Providing a calm and quiet environment. D. Reflecting the client's feelings. E. Offering false reassurance. F. Active listening and maintaining eye contact. Answer. Using open-ended questions, providing a calm and quiet environment, reflecting the client's feelings, active listening and maintaining eye contact. This question focuses on therapeutic communication and environmental strategies for a client experiencing anxiety. Signs of anxiety and therapeutic communication techniques are key. Open-ended questions encourage expression, a calm environment reduces stimulation, reflecting feelings validates the client's experience, and active listening with eye contact conveys empathy and trust. For example, the nurse might say, it sounds like you're feeling overwhelmed. Can you tell me more about that? These techniques help de-escalate anxiety, build rapport, and facilitate exploration of the client's concerns. Question 41. The nurse is providing discharge teaching to a client with a new diagnosis of hypertension. Which lifestyle modifications should the nurse emphasize? Select all that apply. A. Limit physical activity. B. Consume a diet high in sodium. C. Engage in regular aerobic exercise. D. Maintain a healthy weight. E. Limit alcohol consumption. E. Increase intake of fruits, vegetables, and whole grains. Answer. Engage in regular aerobic exercise, maintain a healthy weight, limit alcohol consumption, increase intake of fruits, vegetables, and whole grains. This question addresses essential lifestyle modifications for managing hypertension, with new diagnosis of hypertension and lifestyle modifications as key terms. Regular aerobic exercise, maintaining a healthy weight, limiting alcohol intake, and following a diet rich in fruits, vegetables, and whole grains are all evidence-based strategies to lower blood pressure. For instance, recommending the DASH, dietary approaches to stop hypertension, diet provides a practical eating plan. These changes are crucial for managing blood pressure, reducing cardiovascular risk, and potentially decreasing the need for medication. Question 42. A nurse is assessing a client for potential elder abuse. Which findings should alert the nurse to investigate further? Select all that apply. A. Unexplained bruises or injuries in various stages of healing. B. Client's reluctance to speak in front of a caregiver. C. Caregiver expressing frustration with the client's demands. D. Poor hygiene or malnourishment. E. Client frequently requesting to be alone. E. Financial exploitation, e.g., sudden changes in bank accounts. Answer. Unexplained bruises or injuries in various stages of healing, client's reluctance to speak in front of a caregiver, poor hygiene or malnourishment, financial exploitation, e.g., sudden changes in bank accounts. This question tests the nurse's ability to recognize potential signs of elder abuse, with potential elder abuse as the central concern. Unexplained injuries, a client's fear or reluctance to speak in front of a caregiver, neglect resulting in poor hygiene or malnourishment, and financial irregularities are all red flags that warrant further investigation. For example, observing an elderly client with an untreated pressure ulcer might also indicate neglect. Nurses have a legal and ethical responsibility to report suspected abuse to the appropriate authorities. Question 43. The nurse is assisting with a sterile procedure. Which actions would compromise the sterile field? Select all that apply. A. Touching the outer 1-inch edge of the sterile field with sterile gloves. B. Turning your back to the sterile field. C. Reaching over the sterile field to retrieve an item. D. Dropping a sterile item onto the sterile field from a height. E. Placing a sterile item on the very edge of the sterile field. E. Maintaining eye level with the sterile field. Answer. Touching the outer 1-inch edge of the sterile field with sterile gloves, turning your back to the sterile field, reaching over the sterile field to retrieve an item, dropping a sterile item onto the sterile field from a height, placing a sterile item on the very edge of the sterile field. This question assesses the nurse's understanding of maintaining a sterile field and identifying actions that compromise its sterility, with sterile procedure and compromise the sterile field as key concepts. The outer 1-inch border is considered unsterile. Turning your back breaks visual contact, Reaching over introduces potential contaminants. Dropping items from height may cause airborne contamination or bounce, and placing items on the edge risks them falling off or touching an unsterile surface. For example, if a sterile gauze pad falls to the floor, it is immediately considered contaminated. Strict adherence to sterile technique prevents infection and ensures client safety during invasive procedures. Question 44. A nurse is educating a client about effective communication with healthcare providers. Which strategies should the nurse recommend? Select all that apply. A. Prepare a list of questions before appointments. B. Bring a trusted family member or friend to appointments. C. Assume the provider knows all your medical history without you stating it. D. Ask for clarification if you do not understand something. E. Take notes during the conversation. F. Keep all your symptoms to yourself to avoid overwhelming the provider. Answer. Prepare a list of questions before appointments. Bring a trusted family member or friend to appointments. Ask for clarification if you do not understand something. Take notes during the conversation. This question focuses on empowering clients to communicate effectively with their healthcare providers, highlighted by effective communication with healthcare providers. Preparing questions ensures all concerns are addressed. Bringing a support person can help recall information, asking for clarification prevents misunderstandings, and taking notes helps remember instructions. For example, a client might prepare a brief summary of their symptoms to present clearly. These strategies promote active client participation, improve understanding, and foster a collaborative approach to healthcare. Question 45. The nurse is caring for a client experiencing acute pain. Which non-pharmacological interventions can the nurse implement to help alleviate the pain? Select all that apply. A. Administer morphine as prescribed. B. Apply a warm compress to the affected area. C. Encourage guided imagery or distraction techniques. D. Provide a quiet and dimly lit environment. E. Perform therapeutic massage. F. Encourage strenuous exercise. Answer. Apply a warm compress to the affected area. Encourage guided imagery or distraction techniques. Provide a quiet and dimly lit environment. Perform therapeutic massage. This question focuses on non-pharmacological pain relief methods for acute pain, with acute pain and non-pharmacological interventions as the key elements. Applying warm compresses can relax muscles and improve circulation. Guided imagery and distraction shift focus away from pain. A quiet environment reduces stimuli that can exacerbate pain, and therapeutic massage can relax muscles and improve comfort. For example, playing calming music or engaging the client in a conversation about their hobbies can serve as distraction. These strategies complement medication and offer additional avenues for client comfort. Question 46. A nurse is teaching a group of clients about promoting cardiovascular health. Which recommendations should the nurse include? Select all that apply. A. Achieve and maintain a healthy weight. B. Consume a diet low in saturated and trans fats. C. Engage in at least 30 minutes of moderate intensity exercise most days of the week. D. Avoid smoking and exposure to secondhand smoke. E. Limit consumption of fruits and vegetables. F. Manage stress through relaxation techniques. Answer. Achieve and maintain a healthy weight. Consume a diet low in saturated and trans fats. Engage in at least 30 minutes of moderate intensity exercise most days of the week. Avoid smoking and exposure to secondhand smoke. Manage stress through relaxation techniques. This question assesses knowledge of comprehensive strategies for promoting cardiovascular health, with promoting cardiovascular health as the central theme. Maintaining a healthy weight, adopting a diet low in unhealthy fats, regular exercise, avoiding tobacco, and managing stress are all foundational components of a heart-healthy lifestyle. For instance, recommending walking or swimming for 30 minutes daily provides a practical exercise example. These recommendations collectively reduce the risk of heart disease and improve overall well-being. Question 47. The nurse is caring for a client with a history of recurrent urinary tract infections, UTIs. Which preventive measures should the nurse educate the client about? Select all that apply. A. Wipe from back to front after defecation. B. Drink plenty of water throughout the day. C. Urinate after sexual intercourse. D. Wear tight-fitting underwear made of synthetic materials. E. Avoid douching or using harsh feminine hygiene products. F. Take a prophylactic antibiotic daily, if prescribed. Answer. Drink plenty of water throughout the day, urinate after sexual intercourse, avoid douching or using harsh feminine hygiene products, take a prophylactic antibiotic daily, if prescribed. This question focuses on preventive strategies for recurrent urinary tract infections, UTIs, a common issue. Recurrent urinary tract infections, UTIs, and preventive measures are the key clues. Drinking plenty of water helps flush bacteria, urinating after intercourse clears bacteria introduced during activity, avoiding irritants maintains normal vaginal flora, and prophylactic antibiotics can be used for severe recurrent cases. For example, clients should also be taught to wipe from front to back after using the toilet. These measures are crucial for reducing the frequency of UTIs and improving client quality of life. Question 48. A nurse is preparing a client for a magnetic resonance imaging, MRI, scan. Which information is essential for the nurse to assess and confirm before the procedure? Select all that apply. A. Presence of metal implants, e.g., pacemakers, joint replacements. B. Client's allergy to shellfish or iodine. C. Client's ability to lie still for an extended period. D. History of claustrophobia. E. Client's understanding of the procedure. F. NPO status for at least 8 hours prior to the scan. Answer. Presence of metal implants, e.g., pacemakers, joint replacements, client's ability to lie still for an extended period, history of claustrophobia, client's understanding of the procedure. This question focuses on crucial pre-procedure assessments for an MRI scan, indicated by magnetic resonance imaging, MRI, scan, and essential for the nurse to assess and confirm. MRI uses strong magnets, so assessing for metal implants is vital to prevent injury. The client's ability to remain still and their history of claustrophobia are important for completing the scan successfully, and understanding the procedure helps alleviate anxiety. For example, a client with a cardiac pacemaker would be unable to undergo an MRI due to the risk of device malfunction. Thorough screening ensures client safety and successful imaging. Question 49. The nurse is caring for a client who has a Do Not Resuscitate, DNR, order. Which actions are consistent with this order? Select all that apply. A. Continue to provide all routine medical care and comfort measures. B. Initiate cardiopulmonary resuscitation, CPR, if the client's heart stops. C. Discuss the client's wishes with the family. D. Discontinue all medications immediately. E. Ensure the DNR order is clearly documented in the client's medical record. F. Provide emotional support to the client and family. Answer. Continue to provide all routine medical care and comfort measures. Discuss the client's wishes with the family. Ensure the DNR order is clearly documented in the client's medical record. Provide emotional support to the client and family. This question assesses the nurse's understanding of a do not resuscitate DNR order, which guides end-of-life care decisions. DNR order and consistent with this order are key phrases. A DNR order means no CPR, but all other medical care, comfort measures, and emotional support continue. Discussion with family clarifies wishes, and clear documentation ensures the order is followed consistently. For example, the nurse would still administer pain medication and turn the client to prevent pressure injuries. A DNR order respects client autonomy but does not negate the provision of dignified, supportive care. Question 50. A nurse is preparing to administer insulin to a client. Which actions are appropriate for safe insulin administration? Select all that apply. A. Administer insulin into the same site each time to promote consistency. B. Rotate injection sites within the same general area, e.g., abdomen, to prevent lipodystrophy. C. Pinch the skin before injecting if using an insulin pen with a short needle. D. Aspirate for blood return before injecting insulin. E. Check the insulin's expiration date. If. Verify the insulin dose with another licensed nurse, if required by policy. Answer. Rotate injection sites within the same general area, e.g., abdomen, to prevent lipodystrophy. Check the insulin's expiration date. Verify the insulin dose with another licensed nurse, if required by policy. This question focuses on critical safety measures for insulin administration. Administer insulin and safe insulin administration are the central themes. Rotating injection sites within an area prevents lipodystrophy, changes in fat tissue that affect absorption. Checking the expiration date ensures drug potency, and dose verification with another nurse, per policy, prevents medication errors. For example, injecting cold insulin can be uncomfortable, so allowing it to warm to room temperature is also a good practice. Never aspirate or massage the site after insulin injection, as this can affect absorption.